excess of sodium.
Right.
Okay.
So
That's
therefore,
where Alison
the
should
next
work
thing
at.
is going to tell you why. What's the result of hyponatremia?
Does the rationale still? Sorry, I just took a bite
Yes.
of this.
It's so good.
Yes.
And you do not have excessive.
Right.
We're gonna move on.
Right. I don't. Yeah, I see what you're saying. Rachel.
We're gonna clarify. Who wants to sum it up? Emily's gonna sum it up. Hold on.
Yay, Emily.
Or is it
Right.
Go ahead, Emily.
So, antidiuretic hormone, you don't pee. Inappropriate antidiuretic hormone, you have too much, so you have extra water, it's water intoxication, so therefore your sodium level is diluted. You have a normal amount, but it's diluted because of all the extra water, so you have hyponatremia. And that's it.
Which causes
the change of level.
Which causes confusion in everybody.
Yeah.
We're all confused.
We're all hyponatremia.
Let's just hope we don't get this. We need to rename this.
We gotta keep going so that we can get as many done as we can.
Let's not even talk.
Let's not.
It's you? The vital signs of a 4-year-old child with polyuria are 80/40, 118, 24. The child's pedal pulses are present with a volume of 1+, and no edema is observed. What action should the nurse implement first? Insert a cath, document the child's vital signs and pulses, start an IV of normal saline, or send a specimen to the lab for UA. Why?
Because his blood pressure is low, and we've already assessed his vital signs. And we, the specimen to the urinalysis, I mean, that's something that we can do, but that's not something that is really that important yet.
I feel like the thing the test might want you to document immediately. That's my like when I
I felt tricked on that one too. So, the current vital sign readings and decreased pulse volume indicate that the child is experiencing fluid volume deficit. So the priority action is to restore the fluid. So they're right. Would you agree? The blood pressure is a little low. And the,
I just realized that my blood pressure is low and my pulse is high.
yes. So you're replacing the fluid that they're losing from peeing too much. Okay?
Do you need a doctor's order for that?
You're good.
It's priority standing.
Which action should the nurse implement first? I mean, when it says something like that, you're under the assumption that you have your orders for all of these things. What are you going to do first? I know there is.
It's like a understood view that you're going to consult the doctor.
I know.
Other questions where it's like,
It's rough.
oh, you're going to talk to the doctor.
It's psychological warfare.
Okay. Kara and Carly. A 2-year-old with gastroesophageal reflux, so just GER, right?
Grr.
Has developed a fear of eating. Why would that be? They're afraid that it's going to hurt and that they're going to throw up. What instruction should the nurse include in the parent's teaching plan? Reward the child with a nap after eating. Consistently follow a set mealtime routine. Accept that he will eat when he's hungry, or invite other children home to share meals. B. Good. Why? Any questions there, guys? Okay, next. During discharge teaching of a child with juvenile rheumatoid arthritis, which we know is juvenile rheumatoid idiopathic arthritis, right? The nurse should stress to the parents the importance of obtaining which diagnostic test? Hearing tests, fasting blood glucose tests, chest x-rays, or eye exams?
It's hearing. Yeah. It's funny how your brain just gravitates toward an answer.
I mean, I guess we're gonna go with chest X-ray. Like, I don't know. I don't think glucose has anything to do with like rheumatoid arthritis, really. Does it?
Sorry, how long do you know? I should have told you. We're doing
Yeah,
hair.
you're with me in the apartment now.
So you're
Hearing and eye are like the same sensory, like they're both sensory, so I feel like we should just cross them off. I don't know.
Unless they're giving steroids.
Right, and
Arthritis.
and then in that case, you would want to do a chest X-ray because that could elicit the RA to act up.
Yeah, but then the
So I would
glucose
wanna-
might
I'm
be
just going to
elevated
stop
too.
you
Right.
because
You are
it's
topping
something,
yourself.
something that we didn't cover in class. It was in the reading, but we didn't cover it in class.
Isn't it eye exam?
It is.
I am.
Because
So they're kind of close.
eye problems go along with JA. We didn't touch on it in class. Now you know.
Hearing. So we just would
I don't know.
Is it just like the body attacks the eyes and
I guess.
That would
I don't
pass
know.
aspirin since I don't give it to kids.
If it does, blood glucose.
I'm so glad you brought this up.
ASA tends to be tonight.
Yeah. Tinnitus. Okay.
Does regular like adult rheumatoid arthritis affect it too, or is it just the JA?
I would assume it does, but I don't know that for sure. So visual changes leading to blindness can occur in children with JRA. Regular eye exams can help prevent this complication. Okay? So I'm telling you now, we didn't talk about it in class.
What's the recommended age for an eye exam for a child?
They always have to get one before they go into kindergarten.
Or if they're like
That's when I
into walls
decided,
and
found out
stuff.
that my son was almost blind.
Legit. Like,
Yeah, he, you know the chart?
Smelly.
He could see those top two letters.
Back in the day, this one girl sitting at my friend, she was sitting next to me at a pep assembly, and she couldn't see the cheerleaders. And I was like, what? I'll never forget it. She is very blind. She
Yeah.
has glasses
I
now.
had no idea, but he also couldn't hear. So can you imagine? He couldn't see, he couldn't hear any of those.
Couldn't see cheerleaders.
Okay,
answered your question.
I didn't mean to click on that. A nurse observes a 4-year-old boy in daycare. Which behavior would the nurse consider normal for this child? He's 4. What's normal for a 4-year-old? Demonstrates aggressiveness by boasting when telling a story. You guys, seriously, I just clicked and I don't know. Okay, has a temper tantrum when he told he must share his toys. Begins to cry and is fearful when separated from his parents, or plays by himself most of the day.
We're going to stick with A.
Oh, you are?
Yes.
I thought it might
Wait,
be
why did she seem
positive.
shocked
I
by
don't know.
that?
That's mine.
B.
Okay. What's your thing, Michelle? What are you
I
thinking?
don't know.
4.
What was the?
I think it's B or C.
I've seen a lot of 4-year-olds play that by themselves.
I got it
Oh,
wrong.
you guys were right.
I got it wrong. Demonstrates aggressiveness by boasting when telling a story. 4-year-old children are aggressive in their behavior and enjoy tale telling. Oh, that's so true.
But I feel like aggressive kind of makes it
No, I don't
weird.
like
It's an
Aggressive makes it
aggressive
seem
or
too
like
extreme, right?
Like, yeah.
excited.
Like he has a social
Right.
disorder almost. When he's aggressive. That's what I thought.
They won't give us a
Because
question
that,
that's
they're saying that the temper tantrum and crying are signs of toddlers.
And what age do they play by themselves?
I think a 4-year-old is
Later.
What? I think they mean like when they're like
all
all in your
the
face,
others
like
are
telling you a story, like
Yes.
what leave you alone.
Yeah.
Kind of
Yes.
amazing.
Think of a 4-year-old, and how many of you have like 4-year-olds in your life, and you're like, just please stop talking. That's what it means by like.
That's
I don't like
true.
the word aggressive either. That's what it means by like being boastful and aggressive. Is like always up in your face trying to tell you the story. My husband would call me at work and say, I don't know how to get him to stop talking. He won't stop talking at that age. have less preschool
Tell them
teachers.
Santa's not
Okay? What is
It's our turn.
real.
evil.
Tell them Santa's not real. Though.
The most
Right.
fun.
Okay, next, we gotta keep going. 24-year-old female client tells the nurse that she's concerned about the acne that she recently developed. Which recommendation should the nurse provide? Remove all blackheads and follow with an alcohol scrub. Encourage her to see a dermatologist as soon as possible. Wash the hair and skin frequently with soap and hot water. Use medicated cosmetics to help hide the blemishes. What is it?
You do heat up.
They're with an H.
Yeah, that's what I was gonna pick, but I don't know if soap's super harsh on your face. You know what I mean?
We're thinking C. But what kind of soap is this?
Doesn't matter.
Okay, I'll go C.
Gasoline.
You know how sometimes they tell you not to use like harsh
Harsh
soap?
soap. But you can rule out the other ones. Are you supposed to remove your blackheads?
No.
No. Does she need to go see a dermatologist?
Not right away.
No. She's 14. She's gonna have them.
In those peeling things.
Do use medicated cosmetics to help hide the blemishes.
That's what I.
So that's just the only right answer. So even if you didn't know, okay?
Yeah, and I don't like hot water either.
Because you have to open your pores.
You gotta get on that.
Warm though. Like,
My
Yeah.
grams taught me that. My grams taught me that. You wash your face with hot water because it opens the pores and you can get the soap in it. Then you rinse it with cold water because then you close up the clean pores. My grams taught me that when I was like 8. I'll never forget it.
That's a good call.
I used to put my, we used to like boil hot water.
Oh,
put
and
our
the
face
steam.
over.
Oh yeah.
Yes, to open pores. Okay, here we go. A child falls on the ground next. Sarah and Lindsay. A child falls on the playground and is Child falls on the playground and is brought to the school nurse with a small laceration on the forearm.
Guys.
Which action should the nurse implement first? Gently cleanse it with a sterile pad using povidone iodine.
No.
Apply ice to the area before rinsing with cold water.
No.
Wash the wound gently with mild soap
Yes.
and water. Slowly pour
We choose
hydrogen
C.
peroxide on the
Yes. Hydrogen
We
C.
don't do
Final
D. We
answer.
don't do D anymore.
Drench it.
The mother of a 4-year-old child asks the nurse what she can do to help her own children cope with their siblings' repeated hospitalizations. Which is the best response that the nurse should offer? Suggest that the child come visit a grandmother until the sibling returns home. Go visit a grandmother. Okay, encourage the mother to have children visit the hospitalized frequently. Ask the mother if the child asks when the sibling will be discharged. Inform the parent that the child is too young to visit the hospital.
Go with a grandmother.
Does everyone agree?
Yes.
I mean, yeah.
What preoperative nursing intervention should be included in the plan of the care for an infant with pyloric stenosis? Pre-op, okay. Observe for projectile vomiting. Place in a supine position after feeding. Estimate the quantity of diarrheal stools. Monitor for signs of metabolic acidosis. Whose turn is it?
Wait, I thought it was Emily and Brenna.
No, we just went.
Yeah, they went.
You ready?
Who went where?
You can answer.
It's A.
You're gonna go with A?
Really, to the rest.
Why is it not D?
Because they'll have alkalosis.
Good job, guys. Did you hear that? It'll be alkalosis. You agree, right?
Yeah. Vomit acid.
Vomiting acid, so your base is left. Pooping base, so your acid is left. Okay. Next. A burned child is brought to the ER. He's burned. In estimating the percentage of the body burned, the nurse used a modified rule of 9s. Which part of the body of a child's body is calculated as larger percentage of total body surface than adults? We didn't talk about this because we didn't talk about burns.
Is it B?
But think about the overall percentage of a child and how it's different than an adult. Is this, whose is this? Is this Areli and Allison? Did you guys just answer?
Oh, I answered their question, but okay.
Okay, so it's you and Allison.
Yep. A.
You're going with head and neck? Who agrees? It's head and neck.
Yes.
Doesn't the head and neck make up more of a baby than it does an adult? These two.
I guess, if you remember rule 9, which I do.
Okay, good.
Well, the back of the abdomen is only 2%, which is a large part of their body, so it can't be that. And it can't be the abdomen because that's still a large part of their body.
Right.
And the neck is only 4.5, and that's the lowest there is at all.
Okay,
Right.
good.
Right.
So that's why you need to know the rule of nines in order to just know that. But also if you just think in your head of the difference in surface area. Good job, guys. That was kind of a tough one. Okay, next. Is this Queen? Yep, it's Queen and Lindsay. Okay, as part of the physical assessment of children, the nurse observes and palpates the fontanelles. Okay, so think in your mind. Which child's fontanelle finding should be reported to the healthcare provider? So in other words, which finding is not normal, right? A 6-month-old with failure to thrive has a closed anterior fontanelle. A 28-month-old with hydrocephalus, it has an open anterior fontanelle. A 2-month-old with chicken pox, it has an open posterior fontanelle. Or a 24-month-old with gastroenteritis that has a closed posterior fontanelle. What you going with? You're going with B?
But that's expected.
Talk it out. Whoever's saying that. Go ahead.
Well, we were saying you would think if they had hydrocephalus that one of them would probably have to be open, whereas with A, the anterior fontanelle should be closing later, and the baby's only 6 months.
But should it be closed by 12 to 18 anyway?
Always by 6, I would think.
If there's always excess volume in your head, will your fontanelle close?
No.
Probably not. Does that make sense? A 6-month-old with failure to thrive should not have a closed anterior fontanelle. In fact, she might have failure to thrive because she does. She might be puking like crazy. 12 to 18 months.
Oh, I know.
12 to 18 months.
What are they again? 12 to 18.
Anterior, 12 to 18. Posterior, 2 to 3. Good. Okay, that was good. We're talking it out. Okay, next. Next is Becca and Bryant. Ready? Which growth and developmental characteristics should the nurse consider when monitoring the effects of a topical medication for an infant? Okay, you're giving a topical medication to an infant. What do you need to consider? They have a greater body surface area that requires larger doses, a lower sensitivity reactions to skin irritants, a thin stratum corneum that increases topical absorption, a smaller percentage of muscle mass. We talked about this in differences in skin.
C.
Good. Everyone agree?
Yep.
Remember, that's why we said you have to apply thin layers of things because they have a thin layer, so it absorbs quicker. We're going to take a 5-minute break. Can we take a 5-minute break?
Yep.
If you need to get more food, you can get more food. If you need to go potty, you can go potty. If you get more food, you have to stay and do one of those. I have